नमस्कार. परत एकदा तुमका लायव्ह सॉन विथ मणिपाल हॉस्पिटल या कार्यावळीत सगळ्यांक येवकार. आज परत आमचे बरोबर डॉक्टर जगन्नाथ कुलकर्णी आणि डॉक्टर रोहन बाडवे आसा. आज एका वेगळ्या विशयाचेर जे सगळ्यांक खबर आसा पूण ते नक्की कितें म्हणटा तें सारकें कोणाकूच खबर ना आनी ताका लागून शेजाऱ्यांचें आयकून हाजें आयकून आमच्या तकलेन भंय मात जाता. कोण सांगता ऑपरेशन करूं जाय, कोण सांगता आनी कितें करूं जाय, कोण सांगता कॅन्सर जातलो. खरें कितें आसा तें तांकां विचारुया. वेलकम वन्स अगेन डॉक्टर्स.
Thank you.
Now, there is a misconcept, say there are some vague ideas in the minds of people regarding gallbladder stones. One is kidney stone and one is gallbladder stone. Kidney stone, let us keep it aside. Gallbladder stone. Now, I would like to ask you, what is this gallbladder basically? What is the reason that it is in the body, this gallbladder, and how does it develop stones inside?
Right. Very interesting question. Actually, it's a very interesting because majority of the time when we see patients, they will come and tell us that I have a gallbladder stone. So can you remove it by blasting it? So then we say, no, this is not a kidney stone. This is a gallbladder stone. So you don't blast the stones in the gallbladder. So essentially, what is gallbladder? Now, gallbladder, otherwise called pittakosh. So this is a small organ which is meant for storing juice that is secreted by the liver. It stores the juice. That juice is called bile juice, and this juice is very important for digesting fat food. It is connected to our intestinal tract, and it's connected to the earliest part of the small intestine. So essentially, this contains, the bile juice contains very rich phospholipids. These are some things we should know. Phospholipids, some cholesterols, and some amount of biliary pigments. These are the main things which are there in the bile juice. So because of various factors, I would say, majority of times it is the environmental factors, or sometimes infection, or dietary factors. So the proportion of these three things which I mentioned, they change. So excessive bile pigments or excessive cholesterol, they precipitate or they form the stones. Other times there are these bacteria which travel from the intestines into the biliary tree or the gallbladder, and they cause some sort of mild infection, and around this nidus of infection, the salts and the other things, they deposit, or the cholesterol deposits. So many a times people will have pigment stones, sometimes they will have cholesterol stones. So these are different types of stones one may end up having. So essentially the reason is that there is a change in the proportion of these constituents which I just happened to mention. So that's how one forms stones. These stones are very, very common in women compared to men. It doesn't mean that men don't have it, but women are more predisposed because of the hormonal changes that they go through during their reproductive age. Pregnancy is another thing that makes them form stones, because during pregnancy there's a hormone, so that makes them form stones. So the bile or the stone forming potential is basically dependent on various factors. So essentially it is the environmental other factors plus the hormonal factors as well.
Well, is it related to food factors?
Yes, definitely. So those who are having more oily and fatty foods, mainly those who are obese, they secrete more cholesterol in their bile. That causes hypersaturation of cholesterol and they start forming a stone. Another thing, those who are having on total parenteral nutrition related, these patients will have less mobility of their gallbladder, so gallbladder motility also decreases, and same thing again, they try to use more cholesterol from their liver thing and they secrete more into their bile. Again, this increases the chances of gallstone formation.
Oh, so oily, fatty foods,
yes, obesity, total parenteral nutrition, these are the things. As I said, in pregnancy with the hormones estrogen and progesterone, they both predispose for this thing. Some drugs are there, like we use for anabolic steroids, even estrogens, even tamoxifen. These drugs also increases the chances, risk of formation of these gallstones.
Oh.
Yes.
And age related?
Yes.
Age related, it is. I have operated on children probably around 8 or 10 years old also. So it is essentially the interplay of the hormones and the dietary factors. So that's what comes into picture. Otherwise, there are some congenital conditions where the kid or the child has some conditions where there is a lysis of the red cells, or hemolysis is what we call it. Even those children, because of the excessive production of the pigments, the bile pigments, so they are very prone to develop stones.
What are the common symptoms?
When it comes to common symptoms, so it's mainly the pain. The pain is the one that brings them to the hospital. So otherwise, there is a gamut of symptoms which are clubbed together, and they're called the dyspeptic symptoms.
No, before that pain, let me ask you, gallbladder is on the right side or left side?
Okay, this is another confusion which we
Correct.
which we keep seeing, because every alternate patient, I would say, they will come and say, I have pain here on the left side of the tummy, or probably they would say, I have pain on the left lower side of the tummy, and they say, I have gallbladder stone. So they come with a diagnosis or the determination that any pain that is there in the tummy, whole of tummy, is related to gallbladder stone, because the ultrasound is showing that they have a gallbladder stone. So the pain is usually located in the right side, on the right side, upper part of the tummy, or they can have pain on the back, over the back also. So essentially the pain is mainly on the right upper abdomen or the right side upper back.
Yeah.
That is a common area of pain.
So, गॉल ब्लॅडर दाव्या वटेन नसता, गॉल ब्लॅडर उजव्या वटेन असता. म्हणटकीर दाव्या वटेन जाल्यार दुखता आसत जाल्यार ते गॉल ब्लॅडरा खातीर न्ही. म्हणजे कोण तरी सांगता पोटान दुखता, दाव्या वटेन दुखता, गॉल ब्लॅडर आसतलें, स्टोन आसतलें भितर म्हणून ऑपरेशन करचें पडटलें, तें आयकूं नाका. उजव्या वटेन जाल्यार दुखता आसत जाल्यार गॉल ब्लॅडर आसूंक शकता. आता ते उजव्या वटेन दुखता ताका खूब कारणां आसात. सो मेनी रिजन्स आर देर फॉर ए पेन ऑन द रायट सायड. सो वील आस्क डॉक्टर अगेन, हाऊ डू यू नो दॅट दिस इज बिकॉज ऑफ गॉल ब्लॅडर अँड नॉट एनी अदर थिंग?
Right. Now, the pain that anybody has over the right side, the pain usually appears after food intake, especially after dinner. So once a person has his dinner, a beautiful dinner, and then he goes to bed, so after 1 or 2 hours, he will wake up with pain over the right upper abdomen, or the pain may be on the over the back as well. That is a typical timing. After a few hours of eating food, especially fat-rich food or fried food or oil-rich food, if he has that or she has that, the pain will start appearing. And the pain is something that you feel as if somebody is squeezing your intestines.
Oh.
That's the kind of pain you get. That is with respect to the stones which are, trying to pass through a narrow tube. So the organs inside the body, our body, they will always try to overcome that blockade. So they will try to exert more and more pressure. So the pain is sensed as some kind of squeezing kind of pain. And this pain is so intense at some times that the patient or the person may end up vomiting as well.
Oh.
So once the stone passes off, the pain usually comes down, and the pain usually lasts for a few minutes to few hours sometimes in some people. If there is infection, so the patient will also have fever apart from the pain, or once the patient feels that the pain has come down, so probably it is because the stone has just passed down the track. Now another thing is, if there is infection in the gallbladder, because stones usually block the biliary tree, that's what we call, block the tree, and if there is secondary infection to that, so they may have high grade temperature or fever. Or if the stone is actually blocking the main part of the biliary tree, they may have jaundice also. That is another problem. So the stone may be lodged in something called as bile duct. So this bile duct is a tube that connects to the intestines, and it is from the liver. So it is basically, the stone is basically blocking the bile duct. So they may have that symptom also. They will have jaundice, they will have severe pain, they will be vomiting, and if it is too severe, the infection is too severe, their BP may further drop.
Oh, I see.
So it can go to that extent.
Acha. Now, doctor, tell me, how many stones can be there?
There can be multiple stones. There is no fixed number, so we don't go by the size of the stone. But the smaller the size, the stones are more dangerous.
Oh, smaller are dangerous.
Because smaller stones pass through the cystic duct, the duct which connects gallbladder to the bile duct, and they come down and they lodge in the bile duct, and they cause this jaundice, as he said, pain, cholangitis things. So for CBD stone, so basically gallbladder stone causes various problems, complications basically. One important thing is pancreatitis. So gallstone pancreatitis. Smaller stones are more prone for this gallstone pancreatitis, because they come down and they block the sphincter where our pancreatic duct and bile duct both are joining together to the intestine. So another thing is they can have acute cholecystitis. Again, they block at the neck of the gallbladder. Then they can form the fistula from this gallbladder to the intestine. This is called as cholecystoduodenal fistula. There is something rare complications like Merizi syndrome, where the gallstone in the neck of the gallbladder causes compression over the bile duct. So these are various things, various complications can occur with the gallbladder stone.
Some other complication I would like to mention, if the stone manages to pass down into the intestines, it can even block the intestines. So we have seen patients coming with intestinal obstruction, and when we actually operate and find out that there's a huge stone blocking their intestines. Even those things are seen, commonly seen in fact.
So right-sided pain, vomiting and all, so it can be an emergency.
Absolutely, yes.
Definitely.
Yes.
It may not be emergency also.
It may not be also, because when the patient says that I get pain occasionally, and it happens especially after I eat food, and it goes away, the pain goes away. After I take this medicine or probably I vomit, it goes away. So sometimes they neglect or they say, let me see what happens. So they will keep waiting. So those are the non-emergency situations. Otherwise, there will be some people who will be having continuous pain, they will be having fever, and they cannot bear the pain. So they are the patients who will probably have infection, or the stone is not getting dislodged from the point where it is blocking.
So next is ultrasound only mechanism by which you can diagnose this?
Okay, with respect to the stones of the gallbladder, I would say ultrasound is the best scan. It is the best scan.
Non-invasive.
Probably I would say it is on par with MRI scans. So ultrasound is the one which we completely rely on for the type of the stone, and maybe number of the stones also sometimes, although it is of less significance. But as Dr. Rohan was mentioning, the size of the stone is very, very important. So the smaller it is, more the nuisance, because it can travel everywhere, and our tubing system, the human tubing system, is so small or narrow that even a small blockade will result in a multitude of problems. So ultrasound is one of the best diagnostic modalities available, quick, and we can come to know it very easily. Even in a patient who is very sick, his health condition is not very good, even in those patients we can do a quick scan and come to know what is the problem because of the stone. But there are some situations wherein the stone, if it is lodged, as we were discussing about the bile duct, then we will probably have to think about MRI, doing an MRI, because that is the best investigative modality for the bile duct stones.
And can it be treated medically, or has it to be compulsorily surgically removed?
So medical treatment, there is ursodeoxycholic acid. That is the only thing which has been tried.
What is tablets?
Yeah, these are the tablets. But I'm telling it's not the treatment of choice. There are few reasons. One is that it dissolves the 30 to 50% of the stone over 18 months treatment, as per the largest studies, as per the data we are having. And again there is a recurrence in those patients who are responded to the medical treatment. These will recur 50% of the patient. So if you go that way, there is no effect of the drug which we are giving, and for that long duration. So gallbladder stone, definitely, if it is in a gallbladder causing acute cholecystitis, surgical treatment. But if it gets lodged in the bile duct, CBD, common bile duct, then first we have to tackle with the ERCP. This is a endoscopic retrograde cholangiopancreatography, whereby endoscopically we remove the stone from the bile duct, and then the surgeon, like Dr. Jagannath, they remove the gallbladder. That clears all the problem.
I see.
Yeah, this one thing I think which I should stress upon is, if there is a stone that is detected in the bile duct, that is the tube that connects liver to intestines, the first thing we should do is endoscopically, or by using ERCP method, we should get the stone out from the bile duct. That is the first thing to be done. And then followed by, we should do a laparoscopic surgery to remove the gallbladder. And when it comes to removing the stone from a gallbladder, many have this confusion: are you going to remove only the stone or the gallbladder? And the moment we say we remove the gallbladder and the stone, then say, if you remove my gallbladder, then what will happen? Okay, so let me assure you, if the gallbladder is removed with the stone, you are definitely cured of the problem of having a gallbladder stone later. But the function of the gallbladder is essentially to store bile juice, and it releases the bile into the intestines whenever the food is there in the intestines. So that storage function will be taken up by the bile duct slowly over a period of few months or
Oh,
years.
oh,
Okay,
oh.
so people don't have to worry about what will happen if I remove, if I get rid of my gallbladder because I have stones. So this one common confusion I wanted to clear.
So digestion doesn't suffer.
There is no problem at all if you get the gallbladder out. Now they will ask me why God made it then. So the thing is, I mean, this has been there. So it forms the function of storing the bile. So it's been there. So otherwise, if you remove it, probably they should not be having any problem.
Another important aspect is difference between bile duct stone and gallbladder stone. So whenever there is stone in the bile duct, you have to take a treatment. It's 100% you have to remove that stone. But if stone is in the gallbladder and if it is asymptomatic, treatment is not required usually. So there is as a natural history, there is a risk of hardly 3% per year you will develop symptoms if stone is in the gallbladder. But if it is in the bile duct, it's more prone for severe complications, mainly the pancreatitis, cholangitis, liver abscess and this thing. So whenever stone in the bile duct, you have to remove it. Gallbladder stone, if symptomatic, you have to remove it. But if it is asymptomatic in gallbladder, you can wait.
No, for stone in the bile duct and stone in the gallbladder, symptoms are same? Severity is same?
No, there will be difference in symptoms because gallbladder stones usually do not cause jaundice.
Yes.
But
Okay.
if it is stone in the bile duct, that will definitely cause
Cause
jaundice.
jaundice.
And if it is infected, there will be high grade fever, and sometimes the fever and the toxemia is to such an extent that it may cause decrease in BP, and patient may become unconscious, faint and fall down. So there's a difference between the stone in the bile duct and the gallbladder symptom.
So is it a must that if you have stones in the gallbladder, you must have symptoms, or can it remain
It can be
Yeah.
asymptomatic. Yes, it can be. But there are some patients, I mean, for example, diabetic patients specifically. So a diabetic patient who has a gallbladder stone, of late there are some guidelines which say a diabetic patient with asymptomatic gallbladder stone, he should have or she should have the gallbladder surgery. The reason being the complications that they are going to face, they are much more severe, or they can be life-threatening sometimes if they have stones and they are diabetic. Because pain will not be very much, because as we know, diabetes numbs the system.
Correct,
so
correct.
pain will not be a main feature, because even in a diabetic patient with myocardial infarction or heart attack, they don't feel the pain. So any patient with diabetes and gallstones, they should get the gallbladder surgery.
So if you see the natural history, those who are having asymptomatic gallbladder stone, most of the patient which we see, in that only there is a 2 to 3% risk in next year to have a problem with because of that gallbladder stone. But if you are having a biliary colic or pain because of gallbladder stone, next year chance is 30 to 50%. And the data says ki initial attack is always milder one. But next attack, nobody will able to assure you whether it will be milder or severe. So whenever you are having biliary attack or biliary colic, better to remove the gallbladder. And overall, they have shown the data that 75% of the gallbladder stones are asymptomatic. If you do the study at the same time, 20% will develop acute cholecystitis, only 5% will develop these complications like acute pancreatitis or cholangitis, and less than 0.1% severe complications, Mersey syndrome and fistula.
What is the worst complication that can be if you leave it untreated?
It can lead to,
Cholangitis,
sets in,
sepsis,
it
shock.
can cause-
No pancreatic cancer, no liver problem, nothing of that type.
No, if the gallbladder stones are left behind, it can lead to
It can.
malignancies.
Malignancy of the
More than
gallbladder
once.
itself?
Yes, sir.
It can lead
It can,
to.
yes.
It can lead
Yes,
to.
yes.
It can lead to. So now, do you suggest, looking at this, that it can be asymptomatic, they can be just left there? Do you suggest that after 40s, we advise everybody to do regular diabetes checkup, blood sugar checkup like this? Would you advise everybody to do the first ultrasound for gallbladder and then repeat it after say every 2 to 3 years?
I mean, initial
Is
scan
it-
itself, initial ultrasound scan of the abdomen, if it is not finding any stones or anything in the gallbladder, then there's no need to follow up with our
No,
ultrasound scan.
I
No,
see.
no,
Unless you develop the symptoms.
Yes.
Yeah.
So,
Only in symptomatic patient we advise the scan. In asymptomatic patient there is no need. Unless patient is high risk, as you said, diabetic patient. Another one is the patient who are having hemolytic anemias like hereditary spherocytosis or sickle cell. In that patient.
now once stones are developed, now ultrasound it is proved that stones are developed. A change in diet, does it dissolve them?
No, sir, that doesn't resolve.
Nothing. As I said, no medical treatment is working.
No medical
No
treatment.
dietary
So
habits.
once there is a stone, you tend slowly to walk towards surgery.
Yeah,
Yes.
almost
Yes.
certain.
And how, my regular questions, how long the surgery lasts, how it is done, local, general.
Okay. Now, surgery for gallbladder for, I would say, more than 2 or 3 decades, more than that probably, it has been laparoscopy, because earlier it used to be a big cut on the tummy and they used to remove the gallbladder. Even now that indication exists, but in very, very few patients where there is a contraindication for a particular kind of surgery. Now, this surgery is completely laparoscopically done. And now, what we mean by laparoscopy is, I have a short video, so you can
Okay.
actually show this video so that they understand. I'm just going to talk to you about the basic laparoscopy setup that is necessary. This is the hardware that we need for the laparoscopic surgery. This is a monitor on which we see the images which are captured by the laparoscope. This is the insufflator, which will pump carbon dioxide into the patient's abdomen when we operate. This is the image sensor, which is picked up by the laparoscope, and the image is processed by this device. The one you see here, this is a light source. This will give us light, because when we are operating inside the abdominal cavity, it is completely dark. So we use a light source. This is a xenon light source that we use during laparoscopic surgery. The other devices are energy devices, which are used to control bleeding. A laparoscopy is essentially done under general anesthesia, and the surgery lasts for approximately on an average around 45 minutes. So under this anesthesia, a patient is in a prone position, and we make 3 or 4 small holes over the abdomen, and we introduce our instruments inside, and we visualize the gallbladder and see the entire structure on a monitor. And depending on how the gallbladder looks and all, we use our instruments to remove the gallbladder with the stones. So there is a fine attachment of the gallbladder to the bile duct, which we were discussing about. So we put some clips there, which are titanium clips essentially, so that they are not affected even if there is a need for MRI in the future. So we apply some clips, or sometimes there is a need to tie them because of the size of the duct, and we remove the gallbladder. Now, one would wonder, how would you remove a gallbladder of that size, around 50-60 ml, through the small cuts that we make? So gallbladder is something that has fluid in it. So it's like a balloon filled with water. Oh. So we suck the water first and crush the stones and remove them through the small holes. And the gallbladder, the whole of the gallbladder collapses. So we put that in a particular bag and then extract it through the small holes. And these small holes are closed later. So once the surgery is over, patient wakes up after a few minutes, and then around 4 or 5 hours later, patient walks in the ward, and if they are comfortable, they go home the same day evening.
Oh, I see.
Yes, this is a kind of daycare surgery, or otherwise next day morning for sure they'll be going home.
Oh,
And they're quite comfortable. The pain is significantly less. Bleeding is almost not there. Very minimal bleeding, and they can return to work within few days.
oh. They cannot be bombarded.
No.
like kidney stones
No,
from outside. You
No,
can do.
That's exactly the thing. That's the first thing I used to hear.
Yeah.
Can you not bombard these stones with some rays or some shock waves? No, they cannot. Because
Sorry.
because if they fragment into smaller pieces, we
They
know
will
that
come down.
they will lead to
Ah,
many
smaller are
complications.
more
That is
dangerous.
right. Okay.
Yes.
Any way to prevent them forming?
Stones, avoid the westernization of our food habits. Basically, avoid these junk foods. The way I said, they are more prone, they are risk factors for gallstone, like having high saturated fats, this refined carbohydrates and refined sugar. So basically, avoid junk foods, avoid obesity, take care of your diabetes, it should get controlled, and check for your cholesterol levels. So something like dyslipidemia indicates not only there is a imbalance in your body, but even imbalance in your bile that reflects.
So higher the cholesterol, more chances of the stones forming.
Yes, definitely, because it hypersaturates the bile.
Correct. Now, with respect to the stone types we were talking about,
Yeah.
our Indian, or I would say Asian population is more prone to develop pigment stones. These are some things which are like infective kind of stones. They have a bacteria as the center core of the stone, and on the core of that bacteria, the stones build up. But whereas in the Western population, you will not see so much of infection that travels up the intestines, but you will see more of cholesterol stones in the Western population. So that's why it's very, very essential that you eat clean and healthy. I would say probably our own Indian style of food rather than eating Western.
Westernization.
But any difference between cholesterol stones and these infective stones as far as the prognosis or pain is concerned? No.
No, they're almost, the stone is a stone. It's basically a physical thing which is going to block.
So it is only distinguished for medical purposes.
Medical purposes, that's it.
For a patient, it is
Nothing,
same.
It tells us how to prevent them essentially. If it is a cholesterol
Pathogenesis is
stone, then I would say probably stop eating too much of cholesterol.
Sometimes there are ultrasounds where the radiologist writes something called as sludge. Now, what is that?
Okay.
Sludge in the gallbladder, what is that?
Correct, sir. So
Does
sludge
it turn into stones?
Yeah, there are chances that the sludge may turn into stones. Essentially, sludge is something that is a concentrated portion of the bile juice. So this is the phase of forming a stone. So liquid kind of bile will go into a little viscid fluid that is sludge. Sludge is basically a concentrated bile where the water is out of it. So this sludge, if left alone, may form nice stones.
Okay. म्हाका दिसता आमची सगळी दुयेंसां पळय आसा न्ही ती आमच्या संवयीक लागून जाता. फास्ट फूड, फास्ट जेवप, स्पायसी खावप, पार्ट्यो करप, ह्या सगळ्याक लागून ही सगळी दुयेंसां जाता. आतां हे बायलचें आमी आयकलें आतां जेवणाचेर जाल्यार कंट्रोल दवरत, स्वच्छ घरचें जेवण जाल्यार चडांत चड आमी जेवत जाल्यार ही सगळी हांगच्यान थंय पर्यंत सगळी ह्या पोता पासून त्या सगळीं दुयेंसां आमच्यांनी कंट्रोल करूं येता. पूण जशें ताणें सांगलें तशें प्रेग्नन्सी हॉर्मोनल चेंजीस खातीर बायलांक चड जाता. दुर्दैवान कोणाकूय समज जालें जाल्यार भिवपाची गरज ना. एका वरा भितर आज सर्जरी इतली डेवलप जाल्या, एका वरा भितर दोतोरां कडल्यान गॉल ब्लॅडर काडूं येता. तें काडत जाल्यार फुडें नुकसान जायना, जेवण पचना म्हणटात तें सगळें फट, सगळें आयुश्य आसा तशें सारकें जाता. पोटान दुखपाचें वळवळटा तें सगळें कमी जाता. ते स्वता कितें ठरोवन किंवा कोण शेजारी सांगता, पाजारी सांगता तांचें न आयकता आपूण दोतोरा कडेन वचचें, आपल्याक जाय तें दोतोराक विचारचें, ताजे कडल्यान सगळें समजावन घेवचें आनी मागीर आपूण जाय तें ठरोवचें. इतलें हें सगळें सादें आसा. आनी दोतोरांनी सांगतकीच आमचो तांचेर चड विश्वास बसता की हें सगळें खरें म्हणून कांयच आयकूं नाका. सगळें आमी पयलीं आमचें आयुश्य सारकें जगूंक शिकूं जाय जाल्यार ही सगळीं दुयेंसां म्हाका दिसता आमी पयस दवरूंक शकता. वन्स अगेन थँक यू बोथ फॉर गिविंग सो नायस information about bile stones, which is a common problem with everybody.
Yes.
Thank you so much.
Thank you, sir.
Thank you.
Thank you.